Yeah, I'd like to thank the organizers for putting together a very interesting session. In particular, I think this panel will be very good in discussing this timely topic. There was discussions yesterday about whether energy drinks are like coffee or are energy drinks different. And in order to answer those questions, we have to have a pretty good idea of what the ingredients of energy drinks are. So that's my goal today. I know there are huge gaps in terms of the clinical studies related to this, but I'll give you some of the basic science related to at least so you understand what these factors are. Okay, these are some of the constituents. Actually, this just takes from Dr. Higgins' review article. So we'll focus primarily not so much on caffeine. We'll talk about taurine and glucuronolactone. Then you have a series of vitamins. And then in some of the energy drinks, then you have herbal extracts like ginseng, guarana, ginkgo biloba, and so on. I'll cover a little bit about those. So let's talk with one of the substances where there's not a lot of known about it, glucuronolactone. It was added initially to improve mood and diminish fatigue. It actually is glucuronic acid, which is a naturally occurring substance. It's derived from glucose, so here's glucuronate or glucuronic acid. It's metabolized in humans to the pentose pathway, and so some of these are important. Xylitol in particular is a pancreatic secretagogue of insulin. In rodents, it's converted to ascorbic acid, but not in humans. Okay, this gives you an idea of how much individuals are exposed to glucuronolactone. Normally, about 38 milligrams per day. In average energy drink consumers, about 126. In those with a 95 percentile, it's quite high, 840 to 900 milligrams per day. It's pharmacokinetics. It peaks about 1 to 2 hours after oral administration. I mentioned that it's metabolized by the pentose pathway, and it's important to point out that it's a naturally occurring substance. It's a major component of connective tissue. Okay, there's one real study. There's really not much information about glucuronolactone, but there's one real study that I think that was important done in Europe by the Scientific Committee on Food. And they looked at 13-week oral toxicity exposure to rats. This was a dose response curve. Yesterday there was a lot of science, but there wasn't much dose response curves. So I think in the future we're going to have to do more dose response curves. What they found at higher doses, they saw some vacuoles formed in the kidney. In this follow-up study, there was no vacuolization, but there was some focal inflammation. And the bottom line from this study was that they said that at 300 milligrams per kilogram is completely safe at that level or below, and in energy drinks, you're below that level. There's no studies looking at interaction between that and caffeine that I could find. Taurine is the second one that I'd like to talk about. Taurine is formed from cysteine through decarboxylation and oxidation of the sulfhydryl group. It's a very simple compound. Here are the physiological functions: bile acid conjugation, osmoregulation. Osmoregulation is because there's so much of it around, and that's important. It's actually as high as maybe 10 millimolar in the heart and in the brain. Tremendous amounts, whereas in the plasma, it's in the micromolar. So you've got a huge gradient across the cell in order to get taurine into the cell. It's a neural modulator. Inflammation, hypochlorous acid can react with this amino group that neutralizes hypochlorous acid, so it has an anti-inflammatory action. And I work on the mitochondrial effects, and what it does in the mitochondria is it conjugates with a uridine group on one of the tRNAs. And that uridine is in the wobble position. So what that modification does is it enhances the interaction of the codon and anticodon. So you have enhanced protein synthesis in the mitochondria. Not all proteins, just some proteins. And these proteins become components of the respiratory chain. So if you have taurine deficiency, you have very poor respiratory chain flux, oxygen consumption goes down, ATP synthesis goes way down, and in addition you get diversion of these electrons from the respiratory chain to oxygen to form superoxide. And so you get oxidative stress as a result of it. So taurine is a very important compound in the function of the mitochondria. And as a result, you've got a number of pathological conditions under taurine deficiency: a retinopathy, cardiomyopathy, myopathy, immune deficiency, and developmental defects. This gives you an idea of the amount of taurine in the diet, because most of the taurine that one consumes, or a lot of it, is in the diet. Energy drinks in the high 200s. Heavy energy drink use would be in the thousands. What one sees in terms of elimination of taurine, it's dose dependent. If you administer 30 milligrams per kilogram within the first 6 hours, you eliminate about 20% to 20 to 30% in the urine. But if you administer 300 milligrams per kilogram, a lot more of the taurine is eliminated in the urine. The rest, and most of it, is in the carcass, a little bit in the feces, that's probably in the bile acids, and there's a small amount that goes into the tissues. But even if you administer as high as 300 milligrams per kilogram, you can see that you really don't change. Like here, you exposing, this is an animal, 14 days with 300 milligrams per kilogram, which is a whopping dose of taurine, you really don't change brain levels or heart levels. So the levels of taurine are very constant. There's a lot of them, and they tend to be constant. Okay, this is from a statement that came from the European Food Safety Authority. Taurine, 3 to 6 grams, has been administered daily to a large number of patients. That's adults, children, and even infants. No adverse health effects have been noted. And I saw one point in the literature, they say there were no therapeutic uses. In fact, taurine is approved to treat congestive heart failure in Japan. So let's look at potential interactions between taurine and caffeine. Probably the one that's best studied is diuresis and natriuresis. Okay, in this study, one starts, because there's so much taurine, the best way to see if there's a taurine effect is start with a taurine deficient animal. So we had taurine deficient animals. We use it 2 ways. You can use a taurine transporter inhibitor, because that's the way taurine gets into cells, is by to be taken up. You can use that, or you can knock out the taurine transporter, and we've done both. In this particular study, taurine is a weak diuretic and natriuretic, and that's shown here. In taurine depletion, if you administer IV a small amount of isotonic saline, you get enhanced fluid excretion, high sodium excretion. This would be in the control. In the taurine depletion, this is dramatically reduced. When you try to supplement, you have to basically increase levels very high, and then you can start seeing an effect. So this would be at a level that one does not see when you take a Red Bull or Monster drink or whatever. Okay, this is the one clinical study that has been really well designed. And in this area, one needs a lot more of these types of studies where it's very, very well designed. Okay, what they did is they took energy drinks, some of them where they eliminate caffeine, some where they eliminated taurine. And here would be a case where they eliminate taurine and caffeine. Here's where they just eliminated caffeine. Here they just eliminated taurine, and here you have the complete energy drink. And they looked at urinary output and natriuresis, no difference. So is there an interaction between taurine and caffeine on blood pressure and heart rate? Again, starting with your taurine deficient animals, this is where taurine deficiency was superimposed on hypertensive animals. And you see that taurine deficiency leads to an increase in blood pressure. This was a study with humans. What they judged taurine levels by looking at taurine output in the urine after 24 hours. And which is a good idea. You get a good idea of what taurine in the diet is by doing this. Okay, and they were looking at heart rate, and they defined heart rate below 72.5 as negative and above 72.5 as positive. And they found that in the group that had a higher blood pressure, that you had an increase in taurine excretion led to a decrease in blood pressure, but not in the group that had normal heart rate. There's been studies done with spontaneous hypertensive animals. You add taurine and the blood pressure goes down. This is another clinical study. This is one that it's difficult to get a lot of information from it because it was not, I mean, all they were doing was comparing when you add taurine and caffeine together. They never split it up so that one would add them individually. And you see that there was a decrease in blood pressure in that group without a change in, a decrease in heart rate without a change in blood pressure. But clearly that's not that definitive because you're not looking at interactions because you have the two together. How about arrhythmias? Okay, this is the conclusion of one author. That they said that there's a common cause of ectopic beats is ingestion of caffeine. This would be a toxic doses of caffeine, of course, because we had a good discussion yesterday about how caffeine affects arrhythmias. Arrhythmias are also produced by nutrient deficiency, such as taurine. So taurine deficiency can lead to arrhythmias, not taurine treatment like some people imply. Okay, there was a discussion on vascular effects yesterday. One of the problems that has been raised in the literature is vasospasms. Okay, well, the way one treats vasospasms with its calcium antagonist. So I chose this particular study not because it was designed that well, but because it's testing calcium. Okay, what they did is they took aortas, and in the medium on the outside, they eliminated calcium in this case, and they had calcium present in here. So you'll have calcium uptake. In this case, you don't have any calcium uptake in that case. You add norepinephrine, you release calcium from intercellular stores, and you get tension. And if you had taurine present, no effects. Here, when you add calcium there, you can have calcium being taken up as well as calcium being released from intercellular stores. Again, tension was not affected by taurine, except in the diabetic, and taurine actually reduced tension in the vasculature. How about seizures? That's another issue that's raised in the literature. This is picrotoxin mediated seizures. Picrotoxin interacts with the GABA receptor. GABA A receptor. And in this group, so it induces seizures. In this group, they injected subcutaneously 43 milligrams per kilogram of taurine. Here they fed animals or maintained animals on water containing 0.05% taurine. That's not that high, so I mean it's in pretty good range. And you can see that in terms of seizures that seizures, the latency for seizures was prolonged with either injection or feeding with taurine. And they found that it related to chloride transport, so taurine actually interacted or competed with picrotoxin at the GABA receptor. Another thing that taurine did, this same group found, was that on chronic feeding, you actually see an increase in GABA. And so in that case, there's two possibilities. GABA itself is going to be an inhibitor, and so would tend to decrease seizures, but they raise the possibility you could get downregulation of the GABA receptor. In that case, that might have an adverse effect, but they didn't demonstrate that you could get a downregulation of the receptor. So I'll just quickly go over some of the herbal supplements. Guarana, major thing is the seeds contain a tremendous amount of caffeine, and greater than the coffee bean. So when you add guarana there to the energy drinks, you're adding caffeine or the caffeine metabolites. And then ginseng is another agent. Ginseng contains a number of steroids. This is one of the steroids, and this particular steroid can bind to the glucocorticoid receptor and displace dexamethasone. So the possibility that they might have at a given concentration, that they might have anti-inflammatory actions, is possible. This is a study where they used extracts of ginseng with SHR animals. With SHR animals with age, you see an elevation in blood pressure. Ginseng, this was a concentration-dependent effect. You can actually get reductions in blood pressure, but these were at doses that were extremely high and would not be relevant. This is another effect looking at seizures. This extract, this is a concentration dependent. You get an increase in latency, you decrease in mortality as a concentration of ginseng. And the last one is Ginkgo biloba. I didn't find very much about this. It can increase cerebral blood flow, and the other thing is that it can inhibit platelet activation, but these were at concentrations that were just too high. So that sort of gives you a brief outline of some of the substances that we talk about when we talk about energy drinks. For the most part, from my viewpoint, they inhibit some of the potential adverse effects of caffeine, but I think the committee might want to comment on these as well. The clinical studies are very rare, and clearly there needs to be more studies along those lines. So thank you.